Welcome to Diabeloop Stories, a podcast for anyone interested in the topic of diabetes. We will talk about studies, tech innovations, and our latest news. And of course, we will have lots of testimonials from people living with diabetes. In this episode, we will be talking about the synergies between type 1 and type 2 diabetes and the promising advances driven by the major actors in diabetes, patients, scientific communities and industrials toward a more inclusive approach. Let's hear from our experts, Dr. Sophie Borot, diabetologist, Cécile Feracci, Chief Commercial Officer of Diabeloop, and Tait, a patient advocate from the UK.
My name is Sophie Borot. I am a diabetologist at the University Hospital of Besançon in France, and I am particularly involved in technological solutions to manage diabetes. I therefore meet many people with type 1 diabetes under insulin pump therapy and continuous glucose monitoring in open loop and a lot now in hybrid closed loop. However, I also see a lot of people living with type 2 as they represent more than 80% of patients visiting our center. As a technology specialist, I see mostly patients requiring intensive insulin therapy, which by the way represents about 5% of people living with type 2, which means that there are as many people with type 1 as there are with type 2 under insulin therapy. I can't help but notice that the access to technology is very different. We often hear that people with type 2 are older and less comfortable with technology, that the treatment lies in diet and physical activity more than in insulin therapy, and that they have less glycemic variability and therefore less need for technological tools. However, in my practice, I see people with type 2 on insulin at a fairly young age, while I also see more and more, unfortunately, older people with type 1. I also feel that many people with type 2 face the same challenges than people with type 1, such as hypoglycemia during physical activity, which can be very frequent, especially with insulin-resistant improvement. This can be a major obstacle to physical activity, which is so important for people with type 2. Type 2 diabetes is very heterogeneous. Some people are insulinopenic and very similar to patients with type 1 with inter-day variability. Others are insulin resistant, require high insulin doses. They sometimes have variable insulin requirements during the day and may still experience hypoglycemia when they change their dietary habits or physical activity. It is also said that it is more difficult to control type 1 diabetes, but studies show that HbA1c levels are no better in patients with type 2 on intensive insulin therapy. For all these reasons, I think that technological tools can be of great help. However, technological studies, including people with type 2, are behind. It took almost 20 years to see the first major study on insulin pumps and almost 10 years for CGM. Yet, all of these studies are positive and have shown benefits. We can be happy that this time closed-loop studies have not been too late and they are again positive. To conclude, I think it could be said that although the pathophysiology of the disease is different, technological solutions proposed to people with type 1 can be of great help to people living with type 2, with limited modifications to adapt to a less insulin sensibility and higher insulin doses. It would therefore be beneficial to a lot of people to include this consideration in the design of the new devices.
I'm Cécile Feracci. I'm the Chief Commercial Officer of Diabeloop that I joined in 2018 before the launch of the first AID. So one of the reasons why I joined Diabeloop is the mission. So really the aim of Diabeloop is to bring innovation to people living with diabetes that require insulin. And we want to provide them more choice with our automated insulin delivery solution, improving clinical outcomes and quality of life. They can be type 1 diabetes or type 2. That's not what makes the difference in our spirit. So one of the questions we receive time to time is it more difficult to develop an algorithm for type 1 or for type 2? Basically not. It requires the same skills, and we have the expertise with our engineers to do so. The challenge with type 2 is not so much on the algorithm itself, is more on the fact that patients with type 2 diabetes, they do not have the same experience that type 1 patient, and they do not have the same support neither from also the medical community, as most of the time they are followed up by GPs and not expert center. So as a result, it's what is more important, it's the UX and UI of the device, as you need to develop solutions that are super easy to deal with, so easy to set up and quite autonomous, so there is no adjustment to be done neither by the patient, neither by the doctor. One of the other difference between type 2 diabetes and type 1 diabetes is also economical coverage. And I think for an industrial like we are, this is also a question, because it's developing a product is important, but if you want to make it accessible to the market, you need to ensure that coverage is available. And today, in the actual situation, very few countries are covering high technologies for type 2 diabetes. So this has been one of the challenges, not just for Diabeloop, but certainly, and it's something we work on. One of the things we do to work on is to work on clinical studies and generating clinical data to prove the benefit of our technologies. This type 2 diabetes has been sub-evaluated or sub-studied. So it's really important now to have clinical studies that are dedicated for type 2. So to be able to support coverage demand and to justify it, clinical data are necessary. And as a matter of fact, type 2 diabetes is much less studied than type 1, or was only started to be studied very recently. So one of the commitments of Diabeloop is really to work on those clinical data. And by the way, we are already currently doing a study on type 2s that are at home. Next year on, we will also participate in a study, a French study with several hospitals. It will be a study with type 2 diabetes in hospital in order to shorten the hospital stay and improve the clinical outcomes. So it's really a commitment for us. We know that there is a need for the patient. And again, our goal as Diabeloop is really to provide support to all the patients that require insulin and helping them for the best outcome and best quality of life. So type 2 is part of our scope. And thank you for this interview.
Let me introduce myself. My name is Tait. I'm a person living with type 2 diabetes, and I was diagnosed in March 1999. By day, I'm a hypnopsychotherapist, and I deal mostly with emotional problems such as depression, anxiety, and stress. I'm also a diabetes advocate. I joined DDOC, which is an international advocacy group, to learn more from other people around the world that have diabetes. Through DDOC, I've learned a lot about diabetes and how to control and help my type of diabetes. When a type 2 person goes to a GP or a doctor for their diagnosis, they're often just given a medication and a sheet of diet and exercise, and then said, I'll see you in 12 months' time. However, it is not until somebody has a problem that they understand what diabetes is about. And this could be something with their heart, liver, kidneys, or even their feet. The other way is that people with type 2 tend to hide. And I gave a talk a while ago at a conference about stigma. And I used the acronym of stigma to explain this about people with type 2. S is for shame that we are made to feel, and also maybe cultural as well. The T is the technology that's often denied us, and I is the insulin which is used as a threat for not being compliant or even doing what the healthcare professional tells us to do. G is the guilt that we often feel because we were told it was our fault. It was our lifestyle choices. M is the media that makes the type 2 being a lifestyle disease. And A is for acceptance, to be accepted by everyone in the diabetes community, because it doesn't matter what type we are, we should all be accepted and not discriminate between type 1 and type 2. As we don't discriminate between cancers, why should we discriminate between diabetes? Let's now change the narrative. There are many reasons why type 2 becomes type 2. We need to be accepted and so that we can grow and understand each other and help each other and support each other. For there are 537 million people around the world with diabetes, and only 8% to 10% of those are type 1s. If we had 537 million people as one group, this would be a much larger organisation and give us more power and a stronger voice to influence governments throughout the world. For there is no easy type or hard type, there's just diabetes.
Thanks to our guests for sharing and to you for listening. Stay tuned for the next episode of Diabeloop Stories.